Hello all, it's great to be here with you today at the Learning Festival under the National Centre for Men's Health, promoting health and wellbeing for men and boys through community work, partnership, research and policy. So my name is McGrath. I'm a PhD candidate based in Waterford Institute of Technology. So I'm going to talk to you a little bit today about my research, which is called Sheds for Life. And it's essentially a men's health and wellbeing programme for men's sheds in Ireland. You'll have to excuse me as well. I do have a little bit of a head cold, so I hope I come across nice and clear. So just to get us started, I'm going to share some quotes from the Sheds for Life participants, or the men in the sheds themselves. And I think it highlights that, that there is a bit of an acceptance that men are kind of viewed as more difficult to engage and unwilling to seek help when it comes to looking after their health, and that they simply just fare poorer in terms of their health compared to women. And this belief can be so embedded in our societies that you can see in these quotes from the men themselves that it almost becomes a self-fulfilling prophecy for men. They believe that it is simply not what men do, that the perception out there is that men don't talk. And even more alarming is their belief that it is a failing on them as men. And yes, it can be a consequence of aligned to maybe some more masculine traits like feeling that need to be perceived as strong, but individuals can't really be held accountable for systemic failures in our society and our health services that fail to account for the ways that gender intersects with economical, political, environmental, and social determinants of health, and their influence on men's exposure to risk factors and how they engage with health. Locally, we have a rich landscape of research here in Ireland, our men's health policy, our Healthy Ireland Men framework, which understands that men and also women need health services to understand the different ways that gender impacts health. And this needs to be actualized, which I suppose is the first underlying premise of Sheds for Life. So why do we use the men's sheds to deliver health promotion? So Sheds for Life is a community-based men's health programme. It's brought directly to the men in the sheds, and it aims to engage men with health. The sheds, for anyone who's not familiar with them, are grassroots member-focused spaces. And in sheds, you'll meet men from all walks of life. They're a tight-knit community. Anyone who gets to spend time in them will tell you it's a privilege to really witness that. They bring a wealth of experience and knowledge to share. And there will also be men that may be a little bit more at risk or harder to reach in conventional health promotion, due to maybe their social background, illness, or even by upholding more traditional masculine traits. These men are at an increased risk of poor health outcomes, and they may, I suppose, avoid health services due to a host of complex reasons. So Shed for Life aims to particularly engage with these men. And I do like to think of the sheds as the foundations to which Sheds for Life is built upon. So essentially the sheds are a conducive environment to support a programme like Sheds for Life because of the inherent health promotion that naturally occurs there that Sheds for Life can enrich. So things like the environment is inclusive, it's familiar, all the things that you see here. There's a sense of belonging, there's skill sharing, there's a sense of purpose. It's male specific as well, and there is a sense of safety in that. It's also incredibly important that Sheds for Life does actually enrich the environment of the sheds and any health promotion that we deliver in sheds. So we need to be careful that we don't try to bring too much formalized healthcare into this informal space, as to do so would upset that organic health promotion that occurs there. So the solution is that Sheds for Life is designed in a way that uses gender-specific strategies to engage men while placing shedders or men shed members at the center of the decision-making so that we can understand what an appropriate model will look like. So essentially the crux of the research is a co-designed participatory research approach. And we also do that using implementation science, so we can guide the systematic uptake of programs like Sheds for Life, programs that we know work at community level, embedding them in the real world context from the outset. At the moment, Sheds for Life looks like a 10-week initiative, which has, again, been co-designed by the shed members themselves. It consists of 4 core pillars, which you'll see at the bottom here. So it starts with a comprehensive health check delivered directly in the sheds, weekly physical activity, healthy eating and cooking skills, mental health workshops, and there's also supplementary or modular components that you'll see above. And the sheds essentially tailor and design the program to how they would like it to look like. That gives them a sense of autonomy and control over the program as well, and a sense of acceptability that it's a program for shedders by shedders. Just to give you a snapshot of some of the research, so while monitoring the process and monitoring the implementation climate. We also looked at the effectiveness of the impact it was having on the men themselves. So we delivered Sheds for Life across 4 counties, and we had 421 men participating. For their baseline characteristics, we saw that indeed many of the men did fall into at-risk categories in terms of being out of work or retired, that they fell into maybe some at-risk categories in terms of their objective measures, that maybe they were overweight or obese, that their diets and their lifestyles, by virtue of also being older, maybe they didn't like to seek a lot of information about their health. They may have had family histories of things like heart disease. They had low certainty about how they might want to discuss their mental health. Men that lived alone and were single also may have been in an at-risk category. One thing that we did find was that the sheds were very inherently protective against loneliness, and that loneliness levels were quite low by virtue of being members of the shed. When we had followed the men up to 12 months, we had measured different outcomes. Just to give you a brief snapshot, I know I don't have a lot of time to go into them today. There was significant improvements in things like their subjective well-being, life satisfaction, life worth, self-rated health, their propensity to seek health information, which was so positive considering the cohort of men. Their mental well-being scores and their mental health and self-efficacy also significantly increased after Sheds for Life was delivered in their shed and remained sustained a year later, even for the groups that had been experiencing COVID-19 restrictions. Social capital increased significantly as well. Trust, close support, belonging, physical activity significantly increased. So the days that the men were physically active, the amount of men meeting the physical activity guidelines, and their physical activity self-efficacy. Food preparation and cooking confidence scores also significantly increased, so that they were cooking more often. They were doing this in a way that was using things like raw ingredients. They were more confident about getting their groceries, more confident reading food labels, and more confident with food hygiene, and so on. I just feel like it's an important segue to highlight this as well. Before we even bring any health promotion to the sheds, we know the sheds are inherently health promoting. And I alluded earlier just to the loneliness, how protected the sheds are against loneliness. So we were monitoring a cohort of men over time, and unfortunately COVID restrictions hit, and it did impact the delivery of the program. And you can see here from this graph that when the shed was open, 1.4% of those men actually fell into a lonely category. At 6 months into COVID, it was 29.7%. So almost 30% of those men were now consider themselves to fall into a lonely category. 12 months later, that increased to 39.2%. So it really highlights the benefits of the sheds for men in terms of protecting them against loneliness. Another aspect of what we measured during Sheds for Life, just to give you another brief snapshot, was the economic evaluation or the cost effectiveness of the program. And what we did discover was that indeed, when we monitored this program, it was a cost-effective initiative in terms of the health gains that the men made. So they had a 5.3% gain in their quality adjusted life years, and that came under national thresholds of about €20,000. So it highlights that Sheds for Life is a cost-effective model that has the capability of improving health outcomes for men who do attend sheds, and then also it's cost saving for, the health system. And this quote really sums it up nicely. So I think the bottom line is when people get together, like they have in this program, and start supporting each other, we feel better in ourselves, mentally we feel better, and physically we feel better. Then we don't have to go to our GPs and hospitals. We can come here, so we're saving money there. That's the bottom line, the way I look at it. And I know that was just a really brief snapshot, and there's so much more that I could talk about. But really what I want to wrap up by saying is, I suppose, Sheds for Life demonstrates what we would call a gender transformative approach. So one of the legacies of the program was that men started to have meaningful conversations about their health and well-being by normalizing health seeking and conversations about health within the spectrum of masculinities in the shed. And I say spectrum because gender is not fixed, and we know that too. But the legacy of Sheds for Life is that it fundamentally changes the way men talk. It does so in a way that men do not feel like their masculinity is undermined, but rather that talking is a manly choice. And these approaches are so progressive in advancing gender equality in health for both men and women. As we know, the evidence is that when men feel better, can express themselves in healthier ways, and live healthier lives, women, children, and other men stand to gain and improve quality of life also, as do the boys who follow in the footsteps of these men. So I hope that you enjoyed this brief snapshot into Sheds for Life. The next phase is that we hope to be able to scale this program up to all sheds. And if you would like to contact me, please feel free to send me an email if you'd like to find out more information about Sheds for Life, or you can contact me on Twitter as well. So thank you so much for your attention.